PN4. Q. The nurse is caring for a client with cancer of the cervix. What clinical data would the nurse expect to find in the client's history? Post-coital vaginal bleeding. B. Nausea and vomiting. Foul, smelling vaginal discharge. D. Hyperthermia. Rationale. Vaginal bleeding or spotting is a common symptom of cervical cancer. Answers B and C. The nausea and vomiting and foul, smelling discharge, are not specific or common to cervical cancer. Hyperthermia, in answer D, does not relate to the diagnosis. Q. The nurse is cleaning up a blood spill that occurred during removal of a chest tube. The nurse should clean the blood spill using a hydrogen peroxide. B. Weak solution of bleach. C. Isopropyl alcohol. D. Soap and water. Rationale. According to universal precautions, blood spills should be cleaned up immediately using a weak solution of bleach, 1 part bleach to 10 parts water. Answers A, C, and D are not recommended for cleaning up accidental blood spills. Therefore, they are incorrect. Q. A client with an abdominal cholecystectomy returns from surgery with a Jackson-Pratt drain. The chief purpose of the Jackson-Pratt drain is to A. prevent the need for dressing changes. B. Reduce edema at the incision. C. Provide for wound drainage. D. Keep the common bile duct open. Rationale. A Jackson-Pratt drain is a serum collection device commonly used in abdominal surgery. Answers A, B, and D are incorrect because a Jackson-Pratt practice exam 2 and rationales 141 drain will not prevent the need for dressing changes, reduce edema of the incision, or keep the common bile duct open. A tube is used to keep the common bile duct open. Q. Which of the following is a life-threatening acute complication of diabetes mellitus? A. Neuropathy. B. Hypoglycemia. C. Retinopathy. D. Impaired microcirculation. Rationale. Hypoglycemia is an acute complication of diabetes which can be life-threatening. The immediate treatment with glucose is necessary to preserve life. Retinopathy, neuropathy and impaired microcirculation are examples of the long-term, rather than acute, complications of diabetes. Q. A client with a laryngectomy returns from surgery with a nasogastric tube in place. The primary reason for placement of the nasogastric tube is to A. Prevent swelling and dysphagia. B. Decompress the stomach via suction. C. Prevent contamination of the suture line. D. Promote healing of the oral mucosa. Rationale. The primary reason for the ing-2 is to allow for nourishment without contamination of the suture line. Answer A is not a true statement, therefore, it is incorrect. Answer B is incorrect because there is no mention of suction. Answer D is incorrect because the oral mucosa was not involved in the laryngectomy. Q. The client has a prescription for a calcium carbonate compound to neutralize stomach acid. The nurse should assess the client for A. Constipation. B. Hyperphosphatemia. Hypomagnesemia. C. D. Diarrhea. Rationale. The client taking calcium preparations will frequently develop constipation, so the client should be assessed for any problems related to bowel elimination. Answers B, C, and D are not problems related to the use of calcium carbonate. Q. The nurse is caring